Hi guys, Matt Skeffington. We're back with Technique Tuesday, and a few weeks ago I gave a presentation here at Dynamic on training extended athletes and clients, and since then I've gotten a few questions on some of our breathing drills that we do here at Dynamic before and after our training. And I talked a lot about in my presentation about extension, and I've talked a lot about that in our Technique Tuesdays, is how pelvis position in an anteriorly rotated position, how an elevated rib cage can affect things like hip pain, low back pain, shoulder pain, neck pain, respiration, performance, all these things is position and posture plays a big role in these things. And we use some of these breathing drills, like the 90-90 hip lift that I'm going to do today, to restore more of a neutral pelvis and rib cage position. And this can have big implications on, like I was saying, performance, injury risk. It can shift us from a sympathetic, high stress, fight or flight state to more of a parasympathetic state where we can rest and recover. So 90-90 hip lift, Curtis is going to grab the ball here, and he's going to take a seat on his back. And as you can see, he's at a position of 90-90 with his shins and his thighs, balls between his knees, toes are straight. So what I'm going to cue Curtis to do is rest his hands by his side. He's going to take a nice, easy breath in through his nose. And when he does that, he's going to make sure that he's not breathing in with our neck. For an extension, we love to use our neck to get air in. That's why we have really stiff necks. It feels like we always need to get massage up in there. So I'm going to cue him nice and easy in through his nose, and he's trying to fill his belly and his low back. Not his neck, not let his chest rise towards his face. So he's going to breathe in nice and easy through his nose. Fill up about 3/4, and when he does that, he's going to exhale every single ounce of air he possibly can through his mouth, forcefully, so he's going to blow out like a candle. And as he does that, you can see his rib cage descends, and his hips come up into a little bit of a posterior tilt, activating his hamstrings. He's going to hold that position, breathe in again. Exhale, rib cage comes down, and he lifts a little bit more, about a centimeter at a time, exhaling everything he can possibly exhale with each breath. He's going to do one more. In through his nose, exhale, rib cage comes down, back stays flat, and hips rise. So we usually program sets of 4 to 5 or 5 breaths before, sometimes during, and after our training program, making sure that we're not using our neck, not breathing into extension, and getting every ounce of air that he can out. Thank you.